Welcome, everyone. This is our series of webinars that we're doing on practice management and taxes and investments in general. And today we're in for a real treat. The topic of this webinar is the Business Master's Class to Setting Up Your Own Private Practice. And if you are in private practice or you're thinking about getting into private practice, this is absolutely the webinar for you. And today we have a real treat in that we have an expert in this area, and she's going to give us a whole lot of details about how to set up your private practice and kind of where to go about doing that and get some good resources for that. Before we get into the actual webinar, I just want to remind everyone that this is being recorded and it will be available on our website and also on our social media platforms. So if you're not able to completely join us for the entire webinar, no problem. We will be able to view it later on. That being said, my name is Oghoorian. I'm with ACap Advisors and Accountants. We are a full-service wealth management and a CPA firm. Our focus is predominantly on the healthcare sector. So almost 100% of our clients are either physicians, medical groups, anyone really under the umbrella of healthcare. That's who our clientele is. And today I am super happy to have Debra Phairas. And Debra, please correct me if I'm saying your last name wrong.
That's right.
Okay, perfect. So I'm super happy to have Debra with us. Debra is a president of Practice and Liability Consultants, LLC. It's a nationally recognized firm specializing in management and practice management and malpractice prevention. So her background really expands a multitude of areas in medical clinic administration, loss prevention management for NorCal Mutual, a physician's malpractice insurance carrier in Northern California. She has a BS from Michigan State University and has graduate work from Golden Gate University and MBA in Health Sciences Administration. She has consulted over 2,000 practices of all sizes and specialties. So she is really, really intimately familiar with this space and helping physicians get into private practice and helping them manage their private practice businesses that they have. Her typical engagements include private practice startups, personnel management, evaluations, expert witness, partnership issues, recruitment support for hospitals and physicians group. She's presented extensively at seminars and lectures nationwide, both on local medical and dental also at local medical and dental associations. So with all that, please, without further ado, please help me welcome Debra Phairas, President of Practice and Liability Consultants.
Well, thank you very much for that nice introduction. I really appreciate it. Do I have the controls now? Okay, here we go. Okay, thank you so much for attending. Most of you will remember Maslow's hierarchy of needs, but I like this quote of him, and that's what I usually try to encourage my physicians. Like sometimes they'll say, oh, I'm just afraid to start up a practice. I'm kind of comfortable where I am, but I really thought about doing this. But you know, you may need to really go forward into growth, or you'll just step back into safety. So I'm still setting up practices. Everybody thinks that everybody's gone to the hospital employment, and many have, but then some are leaving too, and they realize that once they've got into it, that they might want to do their own thing and do their practice. So I've started up over 200 practices now. And I'm still doing it. You know, doctors are still starting up practices from scratch. Okay, so you know what's happening. Of course, you're hearing all this all the time. That you know they're employing hospitals and so forth. And then of course now we've had private equity move in as well. But you know, still, especially in the West here, we have one of the highest. You know, I'm hearing some feedback. Just so you know, there's some sort of feedback going on. You might want to fix that. Okay, so the West actually has the most private practice physicians, and especially like Alaska and Hawaii. It's more prevalent for hospital employment in the Midwest and the South. Okay, so you know this is a very good paper. If you want to read a little bit more on this, I'm not going to go into it very much, but there's a lot of detail in this particular article, so that's just a resource for you. But, you know, they are increasing, but it is really, I think that you're going to see a lot more with Medicare and so forth coming down on some of these hospital employed and private equity type things, especially with Medicare, because it's clear that they are performing more services at higher costs. Patients are having more co-insurance costs. So, this may spur some more physicians to leave and go back into private practice. And this is what I've been continually concerned about because of my risk management background, is that I don't want to see conflicts of interest for physicians, because a physician duty is always to do and refer what's in the best interest of the patient. You have a standard of care of what same or similar physicians would do in the same situation. So I've had physicians leave because they were pressured to keep referrals within the hospital system rather than, for example, referring patients out to a university health system due to their severity of disease. So I think that's something that you always need to be aware of if you're signing contracts with anyone, that a physician has to have the right to do what's in the best interest of the patient. And as you can see, the costs have just been continuing to rise. So, and this was a really interesting article that was in our San Francisco Chronicle about showing the differences about how costs have risen in areas where, the hospitals have consolidated. So people are looking at this and they're taking a strong look at it. So what does this mean? Hospitals are going to start to look for ways to cut costs, and that's what I'm seeing: reducing compensation, eliminating or firing doctors who are not productive or cost effective. I actually had a surgeon be shocked because she was fired, and she was like, "But I'm a doctor," and I was like, "Well, but you're an employee," And if they didn't do their homework correctly about having enough business out there for you, and maybe there were too many surgeons in this draw locale, that meant that they really can't support you. So there's a lot that you need to know about going into these, and it's about knowing, have they done their due diligence about really assuring that there's enough business for you, and what is your productivity formula. That's very important, so that you can know that you're going to meet that, and you'll know how you're being bonused and so forth. Okay, so there's a lot of future trends out there, and I'm seeing more and more of this, especially if you want to stay private and start your own practice. The membership access model, that's a lower fee that they charge, and I have OBGYNs that do that, internists, family practice, some of the internal medicine subspecialties like endocrinology or rheumatology that are underserved, and they charge the patient a membership access fee. One Medical is probably the best example of this. And indeed, One Medical, even the second bullet, they have gone out to employers, and they will cover that membership retainer fee as a perk for their employees. And I had some private practice doctors that actually went across the street to Pixar and approached them to do the same thing and said, "Hey, we're right across the street. We can do this for you. Would you, contract with us to do the membership model?" And they did. So that is another opportunity for you. Full concierge is usually about $1,000 or more per year, and that's limiting your practice to probably about 10% of what you used to have, and that's very attractive to a lot of physicians, particularly in the internal medicine specialties, family practice, and internal medicine subspecialties. Some people have gone cash only or out of network, and the patient pays you, and then sometimes they'll submit the insurance for the person for a very low cost. That's out there. Doing more house calls. Urgent care has really grown completely. Micro practices where they're going to cut down on the overhead and do most of the work themselves, like even billing and using billing services and so forth. And then, of course, telemedicine is growing by leaps and bounds for virtual visits. So all these things are in our future. So I think this is something that says 2020. I don't think we're really quite there yet, but we're getting there. And that's instead of going to fixing people after they're sick, to preventive genomic-based medicine. So I think you're going to see a lot more patients out there doing 23andMe or Ancestry.com, getting their DNA, coming to you with, this is what I've been told. Is this true? Should we watch out for these things? That's all happening. And then, of course, you've got a lot of online medicine that it's going to interfere and impact with you as well. So that's something that you also have to be aware of, that's growing by leaps and bounds, particularly with millennials that are on their phones and computers all day long. So this is where it's coming. I mean, it's mobile technology. So if you're going to start your own practice, the most important thing is knowing the demand, and you need to know what the estimated population is to support your specialty. So there are resources. GEMINAC is the Graduate Medical Education Council, the American Medical Association, Hicks and Glenn, and it's very specialty specific. So they estimate, like for a family practice, you need 1 for every 4,000 population, OB 1 to 10,000, neurosurgeons, I think it's 1 to 100,000. So you need to count how many are in your draw area, or even better, ask your hospital medical staff office if they have done that assessment and know what the demand is and how many doctors are out there in your specialty, because they all have to do that. So you can usually access that. So what I usually do when I start to work with a physician to start a practice, I've developed a new practice decision grid, and that's something I've had for about 30 years, 30 or 34, it might be it's 34 now, and I keep updating it every year with new things as they come along. But I've found that you need a good checklist in the order of the tasks that you need to accomplish, and then you have a timeline or countdown. I usually do an Excel spreadsheet, like 3 months out, 1 month, down to 2 weeks, and so forth. But there are many, many resources out there. The California Medical Association and the American Medical Association and many of the malpractice insurance companies have also developed these types of resources for their physicians. The one thing that I would really strongly urge you to do is you might be eligible for what we call the hospital loan guarantee, but you have to approach the hospital before you apply for privileges. That's very, very important. And because if you've already applied for privileges, they won't be able to do the loan. You have to be a certain radius outside the draw area of the hospital, although if you work for the government or Kaiser or something like that, that doesn't apply. But it's a forgivable loan, and they will help you. It's really giving you the gift of a private practice, because they will guarantee you a fair market salary. And I do these for the hospital, so I'm very familiar with the rules, and there's a lot of stark rules with this. But it has to be new and incremental expenses if you're joining a group. But if you're starting a practice, it's you can pretty much do all the expenses. So what it is that they will guarantee you a fair market salary, and whatever money that you use, and it's projected ahead of time, so that has to be done accurately and correctly. So say that you use about $200,000 or $250,000 for starting a practice. If you went to a bank, you'd have to pay that $250,000 plus interest back. But this is a forgivable loan, so every month that you stay in the community, usually for 3 to 4 to 5 years, depending on the length of the loan, that month is forgiven for each of the loan, each month that you stay in practice. So it is an incredibly wonderful gift of starting a practice. The only thing is and Ara and I have talked about this, is that you have to pay tax on it in the second and third year. But that's not that bad, because it might be at the 30% rate or something like that. And so that's all like saying $200,000, you might have to pay your tax at 30% of that, but that's going to be a fraction of what it would be if you had to pay back a bank loan. So it's definitely something to look into, and contact your CEO or the business development person in your hospital to see if you're eligible for that. So the next thing is that you want to discuss with your accountant or your lawyer what your structure is going to be. And are you going to be a sole proprietor? Are you going to be an S Corp, which is the most common for physicians today, a C Corp? Your CPA can explain the differences of that. But for example, in California, you cannot be an LLC or an LLP in California. That's not allowed. You have to be one of the top 3. So in other states you can, but not in California. And I really highly encourage you to have your CPA get you a tax ID, or your lawyer, to bill for into any structure, because you don't want to bill under your Social Security number, much more risk for you. So that's probably the most important step. And it's all about liability and cost and so forth. And again, those advisors can help you make that decision. So in California, we also have another hurdle. And not only do you have to clear the corporation name with the state of California, if you're going to use a fictitious name, you have to clear it with the California Medical Board before you incorporate. So they have you just Google California Medical Board fictitious name permit, comes right up. and you can fill out that application, pay your fee. You can also check to see if anybody has the same or similar name, and that's the whole idea behind this. They don't want the public to be confused with same or similar names. So if you're in another state, please check your own state requirements for this. And you can always check your medical board or your state medical association. So there are definitely, one of the biggest costs other than staff is your rent needs, and you need to get your rent to get insurance credentialed. So you need to find out what are your space needs per physician for the specialty. And Medical Group Management Association, MGMA, is a really good resource for that. They have data on the average needs for each specialty. You also need to know what that cost is as a percent to revenue, expected revenue. So the average is around 6%. So you should do those numbers, have your CPA help you if you need to, or a consultant, and try to project that out, because you don't want to get stuck with a 5-year or 10-year lease and be way over your cost marks. And if you're going to need to have leasehold improvements, I always say add an extra couple, 2-3 weeks, because I've never seen contractors be on time. Not that I don't love them, but they're just never on time. So, there's a lot of cool things you can do today to save costs, things like IKEA and modular equipment. One of the physicians equipped his whole office with this in Berkeley, and it looks pretty sleek and snazzy. So he saved a lot of money by using this modular furniture. You have to have good magazine racks for your patients. Make sure they're up to date, and make sure that they're in good, clear things like this. And in this particular Berkeley one, he didn't put a nursing station in. So when I went in, I said, hey, you've got to have a nursing station for your medical assistants to do their work, to put their laptop there and their phone and everything else. So they actually had to build on this little floating MA station. So it really helps to have somebody who knows kind of patient flow, and there are certain architects that specialize in medical practice. So that's always a good thing to access their expertise as well. So I think it's very important to think about the aesthetics of your practice. And we want you to, even if you're not in the medical spa specialties, it still is very good to think about having a small fountain, radio with nice classical or soft jazz music, and live plants. Patients seem to like this. And, think about the ambiance. That's more of a fountain type thing back there too. Patients want to see, and he has more of a holistic Buddhist type philosophy too. So, you can add your own little stamp to this, but think about your decor. And marketing experts say that you should update or refresh your paint color at least about every 7 to 8 years, because trends change and you'll look outdated. And patients look at outdated decor as outdated medicine as well. So you have to keep up on trends. Think about equipping your office with something like this, unless you have kids. You don't want to have hot water, obviously, with kids around, but nice little water fountain, tea. This particular physician goes to Costco and gets QT oranges, and she said people love the fragrance and the smell and all of that. So that's just a nice little added touch to distinguish you from other physician practices. So you have to think about the way that your office looks in terms of the exam rooms too. And this won a big award for the medical office of the future. So obviously having the nice exam tables that kind of got cut off there, that are raising and lowering, because elderly patients can't get up on those exam tables very well. So you need to have at least one of those tables. When I'm setting up a practice, I always put in one raising and lowering table, and the other two can maybe be regular tables. But you want to have all your blood pressure stuff and everything, all your vital signs up on the wall, secure, so they don't walk away. A place for you to do your charting, although I don't like to see doctors turning their backs to the patient, so a little stand is actually even better. And then having every exam room be exactly the same, with everything in the same place. And I just went into my OBGYN office, and I was asking her how she liked the whole new hospital build out of medical offices. And she said, well, there's pros and cons. She said, the thing that drives me the craziest is that I can't remember where everything is in the different rooms. So that should be standard for physicians, so that it increases their efficiency and they're not looking for stuff. So the other thing that I suggest is that you make a commitment to eliminating clutter. And nothing looks worse in an office than going in and you see stickies. That's the bane of my existence, all over the place. Lots and lots of paper. That's the wonderful thing about electronic medical records, is you have charts all over the place. But even in your business things, organize your files, because it saves time and labor costs looking for things, and shred or move to storage any unnecessary paper. So this is what I'm talking about, having nice lateral files, everything in, organized, everything in binders or folders, so that everybody can get to things quickly. And like I said, eliminate stickies. I hate stickies all over the place. They just look messy. So the next step that you want to do after you get your rent, and you can secure your address and rent even though you don't move in. So sometimes they'll let you lease and sign a lease maybe 3-4 months ahead of time, and that's good because you're going to need those 3 or 4 months to do insurance credentialing. So you have to have an address, and you have to have a phone and a fax number in advance. And you can secure those as well, even though they're not installed. So you can call up the phone company, or if you want to do voice over IP, Comcast, whatever it is that you want to do, and get your phone number and ask. They'll give you 3 choices, and if you don't like those, you say, no, I want 3 more choices, until you get something you like. And if you want to have it spell something, then see if that's available as well, like 1-800-PAIN or something like that. So, but you have to have both a phone and a fax number, and you can have e-fax if you want to, but you have to have a fax number. That's essential for insurance credentialing. So then the next step is setting up your banking, and you need to have that. You need to do that after you have your tax ID, and because you're going to need that plus your articles of incorporation if you're incorporated, and you need to take that to the bank to open up a business checking account. So keep this separate from your personal. Now, there's another thing that you might want to consider starting a new practice, because there's a lot going on, is it's a concept called lockbox, and that's a P.O. box at a big bank. Not little banks usually have this, but large banks do. It's basically a P.O. box, and that's where all your checks and patient checks will go to. And it costs more, but there's a benefit in that your money gets into the bank the day it's received. It's secure because they have 2 people opening the checks and the EOBs. They scan those, and that's all that your billers need to post is the check and the EOB, the explanation of benefits. So that can be very secure, and it keeps you from having to run to the bank all the time making deposits, although check scanning is so easy now that that's almost the same. So I would evaluate all of those. You might need, if you can't get a hospital loan, you might need a bank loan. And I just met with the Blvd people on just this week. So Blvd, Wells, Chase, and First Republic all have physician special loan divisions. So it's not your branch, it's special divisions. And they are absolutely so willing to loan money to physicians, actually physicians, dentists, and veterinarians, because they know that they're a good risk. I mean, they were talking about how many billions of dollars they've loaned, and it's like a less than 0.5% default or something like that on loans. So they like to loan money to doctors, and they will loan money, just a new doctor out of school on the strength of the medical degree as collateral. So that's what you need to know. But it is good form to prepare a capital budget and a working capital budget, just so that you know what you're going to need. So capital budget is all of the equipment and furnishings and things that you need, and your working capital is projecting your revenue, your expenses out for at least a year to 2 years. If you need to pay yourself, and then what's the negative that's going to be what you need for the loan, adding to the capital budget will be what your total loan is. So that's very important to do those projections. And I might want to stop here is this saying that it takes almost all businesses a full 3 years to be up to speed. And that is also true of physicians. And that's why the hospitals did that hospital loan guarantee, so that they could give you that first year, which is the toughest one, that you wouldn't have to worry about paying yourself. So just be prepared that, the first year you're not going to make much money, and then it gets a little bit better the second year, and even better the third year. So you need to do a lot of marketing and get yourself out there so that you can have a good practice. So this would be a sample capital budget, the items you need. That's not all of them, but it's just a sample. How many, the quantity, what's the usual cost, and you add them all up. working, you know, in this, oh, there's some more for it. So actually more. So you can just use this if you need to kind of look at these things. And I would add in marketing, website design, all of that, consulting, credentialing, legal, CPA, whatever it might be. So that would be a typical maybe family practice or internal medicine capital budget. And then this is what I'm talking about a new practice loan pro forma. You're going to estimate the money coming in, the revenue, month by month, which as you can see, it starts out low and grows, and then your expenses and all of your staff and everything else. And what's the loss, which is the bottom line here until you maybe break even, but then you still have maybe a loss for the year. So that $86,000 plus your $47,000 for your capital budget would be at least what you need for a loan if you have to give yourself, and then if you're going to only pay yourself a slight $10,000 a month. If you have to pay yourself $20,000 a month, then it's just going to be more that you need. Okay, so that's it. That's in a nutshell. So you have to get your loan, and then you also have to get a city business license, and you have to have that for Medicare. So you do that after you've gotten your checking account, your address, and your phone number, and your structure, because they're going to want to see that for your business license. Then you're going to talk with your CPA, and you're going to set up your accounts payable. Accounts receivable is what you bill insurance and your patients. Accounts payable is what you pay your rent and your staff and so forth. And I believe in QuickBooks. There's some other Peachtree and some other ones, but QuickBooks is kind of the gold standard for small practices. And there's lots of training classes out there, but many, many office managers know QuickBooks. So you're set that up on QuickBooks, get a good chart of accounts. A Medical Group Management Association has a good chart of accounts. So, and most CPAs that work with physicians know this very well. So that you're going to talk to them about setting up your estimated quarterly tax obligations, very important. And you're going to always discuss lease versus purchase options with your CPA because they can give you the benefits of that, and of course your tax preparation. Next, you're going to need insurance brokers, and you need your general liability insurance is required for your lease. So your lease will dictate the terms of your general liability. It's usually $1 million, $2 million needed, but you'll have to get that. Then you also should have, as a business owner, you should have life and disability insurance. You're 6 times more likely to be disabled by the age of 60 than to die. So that's why good disability insurance is important. California Medical Association, your local medical societies, or your medical specialty societies have all worked with brokers to get good disability insurance. That's for covering your living expenses. Business interruption insurance covers your business expenses, like say if there's an earthquake or a fire, your rent may still go on. So, if you couldn't open up your business, then this would help cover your rent and your staff costs. In California, the day that you employ staff, you must have workers' comp insurance. It is mandatory. Not too long ago, I found a physician that never got work comp on his employees and thought, well, why do I have to do that? I'm a doctor. It's like, now you're an employer in California, and California requires that. That's it. You have to follow the law. So that's essential. And then, of course, you need good malpractice insurance. You're going to make a decision whether it's going to be $1.3 million or $2.4 million. That's a decision that you need to make depending on your specialty. And then you're going to have to decide whether or not you're going to offer health, dental, and vision insurance for your employees. Usually I recommend in the beginning, starting a practice, only offering health insurance to your employees. And then, encouraging them, if you help build my practice and make it successful, we can add on additional benefits, a dental, vision, and then a 401k, profit sharing, all of that. But I can't do that usually right from the beginning. And I highly encourage you, because of the labor law climate we have here in California, that to consider employment practices liability insurance, okay? That's employment practices liability insurance is very important to help protect you against labor law. That actually is a mistake on there. That should not be business interruption. That was up there. It's employment practices liability insurance. Okay. Insurance plan credentialing, that is a big deal. So that's why you need to start out. Ideally, we suggest that you start 6 months out from the day that you want to open your doors by planning a new practice. Even longer if you want to do extensive leasehold improvements and things like that. But at least 4 months out, because it's taking longer and longer for the insurance companies to get it together to get you on their contracts. So you're going to have to decide if you're going to do it yourself versus having an expert do that. It's a lot of paperwork, it's a lot of follow-up, and a lot of phone calls. So, and you know, it's a lot of work. So you also have to get your NPI if you're solo, or your entity NPI if you're going to be ever adding on new physicians. So if you think down the road you're going to add on new physicians, I would definitely do the entity NPI for Medicare. Then you have another decision about whether or not you're going to be in-network versus out-of-network contracting. I usually suggest that for new practices, you go in-network with everyone and then reevaluate that a year and a half out to 2 years and say, do I need to either renegotiate these contracts or dump them? So, but in the beginning, you just need to build volumes. So it's a good idea. I've had several physicians that have left other entities saying, I don't want to take this insurance and I don't want to take that one. And they struggle a little bit. So that's really what I suggest that you do in the beginning. Then you have to get set up with all your vendors, and you have to get set up with your medical supplies. And I don't have any conflicts of interest with any of these people, but McKesson's the big one. They have they already have things set up for new practices, so that's why I kind of like that. They know what this is all about, so they'll help you with all the supplies that you'll need for your specialty starting out. And certainly if you're oncology or any of those, you're going to have to, those are big dollar supplies, so you have to plan that and put that into your Proforma as well, because you're going to have, you know, those big dollar expenses from the get-go. And then office supplies, Office Depot, Costco, some of those are the best thing. I strongly urge you to set up an online account, because you should never send staff to drive, because you will be liable if they get in an accident, if they're driving someplace. So don't do that. Just order it online, and they almost always deliver if you order a certain amount. Office Depot now doesn't even have a limit anymore, so that's pretty good. And then office equipment and furniture. Are you going to buy used or new? And there are many, many used vendors now, and even eBay and .med.com, they have refurbished equipment. Many of it's guaranteed or warranted. So that's a great way to save about 50% of costs. I had a doctor's wife buy all reception furniture from LA and had it shipped to Northern California, and it was still cheaper than new. And it looked like brand new. And I was out in my office in San Francisco one time, and these businesses go in and out of business all the time. There were like 10 Aeron chairs on the sidewalk just saying, take me, because they upgraded or they went out of business or whatever. And people were just walking down the street with these brand new, you know, gorgeous chairs that probably cost about $500, and they were free. So that's the way to save costs. So now you have to think about some marketing issues about starting your practice. And I still like this. It's kind of old, but I really liked it a lot. And you have to think about what it is that your patients like about you. They don't know how smart you are as a physician. They don't know you're alpha, omega, alpha, or whatever, you know. You're a doctor, and they can't rate your medical competence, but they do rate your personal competence. So these are the things that they like, and that's something that's really important that you pay attention to. And I love this slide. I just think it's really funny, but it's pretty true. You know, I mean, they're just kind of uncomfortable when they're up there on that exam table and they don't have any clothes on. So make sure that even, you know, the insurance companies got into this and say, you know, take somebody with you, you know, as a patient, encourage that, so that they can remember things, because studies show that they just, even when they're right there in front of you, they think they're going to remember, but a day later, it's out the brain. So that's why written handouts, good informed consent, all of that is critically important. So internal marketing is still the most effective marketing for physicians, and having happy, productive staff. Choose the best receptionist and telephone person you possibly can, because that is the director of first impressions for your practice, and that goes a long way. Convenience of your office hours today, particularly in high commute areas, very, very important. So maybe thinking about having one early morning office hours per week and one a little bit later till 6 or 6:30. That helps the commuters, and they really appreciate that. You have to be willing to discuss fees, but always explaining that fees may vary depending on your medical needs, but they don't want that hidden. So there are a lot of other inexpensive marketing things that you can do, and these are magnets, refrigerator magnets. They're very cheap and easy, and people put them up on the refrigerator with all their pictures and everything, and then other people that come to the home say, oh, hey, it looks like Dr. Catchpole got a new doctor. What do you think about him? Oh, he's great. Well, I'm thinking about changing, so I think I'll give him a try. Those are the things that happen. That's word of mouth. And then you need a very good professional picture of yourself, and a good brochure and a good website, because people are looking for this online. So, smiling doctor face, they love the stethoscope around the neck, and they want to look at that nice, pretty office and all the things that are about, your practice and what your philosophy is and all your credentials. So that's important to be in a brochure and on your website. So if you're a specialist, you need to do a little bit more, and you need to always know where your referrals are coming from. So your intake forms always ask, how were you referred, or how did you hear about our practice, with multiple choices. Website, referral from Dr. So-and-so, referral from friend, whatever it might be, so you can really evaluate the effectiveness of your marketing efforts. So you want to track these referrals, and if they're falling off with physicians, then you need to step up your game and find out why they're falling off. And one of the best things that you can do as a specialist is go and visit and ask referral doctors. Number one, you can prey upon their sympathies, just say, geez, I'm starting up my new practice. It's a little daunting. Do you have any tips? How did you do it? So that gets them talking about themselves, and they're so pleased that you've asked for their help that really makes them like you a lot, and they'll probably refer to you. And then at the end, you ask, well, if I'm lucky enough to get your referrals, how would you like those to be handled? Would you like me to phone call you, text, secure, HIPAA compliant, letter, fax, and then keep a list? I saw this, a GI did this many, many years ago. I thought it was brilliant. And he had it right on the bulletin board next to his phone on his desk. And before, he would always just consult that and remember that he would do what they wanted, because your referring doctors are your other customers. Your patients and your referring doctors are both your customers, and you have to treat them very well. You might even consider a fact sheet. I had some retina doctors that they just faxed it out right at the end of the visit, what they found. And that was very, very important to their ophthalmology referring clientele. I think you as a physician need voicemail for other physicians to get into in your personal calls, so that you can give that out, not to your patients unless you want to, but it enables your staff to say, doctor's not in right now. Would you like me to take a message, or would you like his or her voicemail or text? And then they can give that choice to the referring doctors. So being available, affable, and all that is very important. Now we go to the staff, and I like this visual because medicine is a team sport. You can't do it just with the doctor alone. You have to have excellent staff to help you in this process. So this is just kidding. Flogging will persist until morale improves. No, that's not effective management. And I kind of joke and tease my doctors that you had the worst training in human resources management going through medical school. It made you a good doctor, but it doesn't make you necessarily a good boss. And that's because physicians are humiliated by their attendings in front of the patient and their peers. And that's to make you not make mistakes, but that's not good to do with your staff. They have a thin skin. You've developed a thick skin, but they have a thin skin, and it's very humiliating to them to be chastised or reprimanded in front of their peers. So it's praise in public, reprimand in private. Those are the best words. And as I mentioned, this is just a joke. They seem happy now, but who's going to sue you for wrongful termination, et cetera, et cetera. So that's why having good employment practices liability and understanding California labor law is critically important. And I would suggest that you join the California Chamber of Commerce. It's very inexpensive, and they have continual updates on California law. And there's something that happens every year. So you have to change your personnel policies and procedures and so forth. So when you're recruiting for your staff, you need to check your references, obviously. Don't just take paper or letters of reference, actually try to get references. Check their documents, I-9, for the to make sure that they're legally able to work in this country. That's very important. That's your duty and your obligation as an employer. And I strongly urge you to do background checks and drug screens. It isn't that expensive, and it's well worth it, because if you tell people you're going to do this, then the druggies and the criminals will probably disappear before you even hire them. And your offer is contingent. You can't do it till the first day of employment, but your offer is contingent upon successfully passing these, or you can rescind the offer. So it's a good thing to do. Discuss all those organization duties and responsibilities with the candidate, and have excellent job descriptions. Okay, so that's just my little joke about the drug screens, just a little funny joke. I thought it was funny when I saw it. Okay, I really strongly urge you to have a good employee personnel policies and procedures handbook and all the forms that go with it. Okay, I do have a conflict of interest here, sort of. I contracted with an attorney to do a medical practice one, and we update it every year, and it's excellent. But the Chamber of Commerce also has good ones, and some of your malpractice carriers have good ones too. But this is important, that they get their handbook and that they sign this statement that goes in their employee file that says, I have read, received, and understood the personnel policies and procedures. That's your protection as an employer. So California, there's a lot to this, but we have the most stringent labor laws in the country, I believe, and you have to pay them for anything over 8 hours, even if they don't work 40 hours that week. So if Monday they work 8.5 hours, but they only work 32 hours that week, you still have to pay them for that extra half an hour at time and a half. So that is absolutely what it is. And if they work double time after, you have to pay them double time after 12 hours. And that's been in effect since 2000, but I still have people that don't know that. And so if you're not in California, find out your state labor laws. So I really, really believe that at some point when you become successful and you are, if you have more than a 2 to 3 week wait for patients to get into your practice, that means that you have enough volume to add another person in your practice, either a physician or an advanced practice clinician. They like the term that rather than mid-levels right now, but those are nurse practitioners and physician assistants. And they're Zubin Damania, he goes by ZDog MD. He's created a great model with the Zappos model in Las Vegas, and that's using all these other people as a team effort. So their liability issues are very low. I know that from my malpractice work. So patients like them, they can get in faster, and it really truly does expand your practice. So think about that and consider that. It can be other things like advice RNs, health educators, all these other people. And you can delegate your work so that it's like, engineers changing spark plugs. A physician doesn't have to do everything that other people can do. And behavioral health has definitely done that. They have MFDCs and psychologists, and the physician is the psychiatrist and does all the meds. So they can delegate downward. So another thing that I think is critically important is that you really think about securing your office with your technology. Don't scrimp on this. Make sure that you have very good cyber security. You might even want to have cyber insurance as well. And don't be taken, that's what I loved about that, when we went to electronic medical records, is that people weren't taking, voluminous charts home in their back seat of their car or their trunk, and it got broken into. But now it's laptops. So you need to make sure that your laptops are secure, and, you can get fined for this, and you have to report it. So, and everything should be HIPAA compliant with emailing and texting. So use the compliant type technology so that you can text securely with your staff. Oh, and in California, if you expect your staff members to text or take phone calls from you during work, then you have to pay for a portion of their cell phone. So that's something that's also a California law. So what is benchmarking? So you need to know what are some of the key indicators in your specialty, and it's very specialty specific so that you understand and benchmark yourself. So it's very important that you do good profit loss reports, work with your CPAs and your managers, that it is a management tool, because we use that to really better our practices. And you can see MGMA says that more than 60% educated in their physicians, and the best practices do this all the time. So basically, if you're a sole proprietor, your profit loss is going to look like this. It's going to have the revenue on the top, all the expenses, and what we want the CPAs to do is have a percent to revenue column next to it so that you can see what percent to revenue, that's how we benchmark in cash for practices, and compare this to your peers. And what's left over is what the doctor gets. If you're a corporation, it's going to look slightly different, and your officer, physician, is going to be included in your expenses. So that's going to be a line item, but you just subtract that to get the exact same overhead ratio, because you want to have not very much net income. This is your physician income, but then you want to have little net income so you don't have to pay tax on it. But it's the same thing. So we want you to understand what resources are out there for you to have a lean, mean fighting machine overhead, because overhead keeps rising and reimbursement is not rising the same percentage. So we have to really be careful about this. So these are the key benchmark places. So know your productivity, and it is very specialty specific. You can see the differences between internal medicine and family practice, which is both primary care. Family practice sees more visits. So they're usually younger, healthier people. So you want to keep track of all your patients seen, new patient growth, hospital visits, surgeries, income generated by doctor, and have budgets. I really like budgets, and you can see how you're doing in your budget year to date and where the variance is. So we want you to not have your money go down the drain through careless management. So you want to be attentive to every practice or penny your practice spends. That's very important that you do pay attention to this. And involve your staff, because if you involve your staff, they will help you and look for ways to save money. So for example, this is family practice. This is what I'm talking about in terms of benchmark ratios. What are you spending as a percent for each one of these line item expenses as a percent to revenue? And the MGMA has gone up dramatically because so many of the participants are hospital-based practices now, which people did a better job when they were on their own. And you need to know what your full-time equivalents are, and that varies depending on what specialty you are. If you're a surgeon, it's going to be low. If you're an orthopedic surgeon or an ophthalmologist, it's going to be high. So you need to know both of these. Very important. Varies by specialty. And you also need to understand your accounts receivable ratios, another joke. So I'm not going to, this was like most practices lose 12% of their billing because they're just not looking at it. And you have to understand that a billing service isn't going to chase a lot of dollars if they're getting 5% of what's collected. They're going to put their efforts into the easy, low-hanging fruit and not so much the appeals and denials. So I like to see a good monthly flash sheet that's like a dashboard or a flash sheet, and it has the key indicators that are presented to the physicians on a monthly basis. So you can see right away what your key ratios are. And that's a whole different seminar about the ratios. So that's a whole another thing. So staffing is your biggest cost. You want to hire for attitude, train for aptitude, use RNs, medical assistants, RNs for triage, MAs for assisting, and try to use per diem or part-time people for MAs, because those are directly tied to the doctor's production. And I'm a real believer in scribes. You need to do a cost-benefit analysis, and you can have live scribes, or there's a lot of artificial intelligence products now that are scribes. So that's really something you should take a look at, but it's almost always a good cost-benefit analysis for the physician to see maybe 2 more patients a day, not having to do all the paperwork versus the cost of a scribe. So again, overtime has to be authorized. You have to pay them, but you can start disciplining them. Evaluate your benefits every year. That's very important. And I always throw this in because it's just hysterical, is that's where we're losing good people in the medical field to all the tech that we have so prevalent in California, because they have really cool perks: food court, pool tables, ping pong, bowling alleys, all that kind of stuff. Who wouldn't want to work there versus in a medical practice? So, most people do vacation. It's usually 2 weeks to start, and then it goes up to 3 weeks after 5 years, 4 weeks after 10 years, and that's usually the cutoff. But look at some of these surveys to see what people are providing. So have good job descriptions, use interns, maybe college students that want to get into medical school for scribes. And I always believe in creating incentives to reward staff for ideas that make or save the practice money. You will benefit from that. And this is what Peter Drucker, this is what you learn in MBA school, Peter Drucker. And, again, it should be from the bottom up instead of the top down for, input into processes and procedures. So you want to join organizations to get discounted rates for, say, like your merchant credit cards. Shop around for that. Pay your bills on time because you get a discount if you want to negotiate malpractice insurance, and take advantage of the discounts by attending risk management programs. And your local and state medical association have lots of discounts for services. So we want to have good patient forms on your website because that saves labor costs and it saves time at the front desk, so they can download them and fill them out at home and bring them in. Reduces demographic errors for billing. They can even input on a patient portal sometimes. So these are just examples of what people do. Okay, so this is, boy, I was just in an ophthalmologist's office, yesterday, and I heard this patient complaining, has the doctor forgotten me? I've been sitting here forever, and that's the big complaint. So try to stay on time, because you do not want, as a new practice, people looking like this out in your reception area. That's bad marketing. So, again, you need to look at your waiting times, and there's a direct correlation between rating stars and waiting times. So the lower the waits, the higher the rating stars. The longer the waits, the lower the stars. So, this is also, no-shows are a big deal. So you want to do everything you can to prevent no-shows by text reminders and call reminders. So again, physician, you need to be very up on technology. They think you're up to date and with it if you're using good technology. And duplicating, using charts and EMR, I was, again, just in this practice yesterday, it's like a security blanket for the physicians, but it's costing them a lot of money to do duplicative work. So you want to have good branding, create a theme for your marketing, logos, colors, cards, stationery, brochures, website. It should all look the same, consistent style, okay? Again, I mentioned that, a purple iris theme carried out on all logos and stationery. This happens to be my mother's physician, my physician, and my client here in Napa. And he was known around town as the Red Bike Medicine Doc. And so my person created this whole logo and theme for him. And everything is consistent throughout, including, all of his marketing materials and when you walk in the office for the first time. So it's very consistent branding. But don't advertise in yellow pages anymore too much. Invest in good website and search engine optimization. Have content management so you can change it easily and track your marketing efforts. So this is really the theme. It should be mobile optimization. You can create your colors or your theme about what your philosophy is. These are all things that you need to do. And be aware that the website can be your friend or your enemy, because people are Googling everybody now, and they will find out about you if you've been disciplined by the medical board or whatever. So 38% do research seeking out doctors, so be aware of that. And then have an open house about 2 to 3 months after you open up your practice, and invite anybody that could be in a position to refer to you. And a way to save costs is have drug reps contribute trays of food. So they'll be happy to do that for you. Take advantage of state and local medical societies. They have free or low-cost seminars and webinars. And so take advantage of those online continuing medical education programs for all of your physicians, your advanced practice clinicians, your staff, managers, everybody. It's a way to save money on those. So I like to end with this and say, you know, these poor doctors, they always thought that all they were going to have to do for the rest of their practice life is keep up on their specialty, but then they have to learn all this other stuff that they never taught you in medical school, like the business side of the practice. But I always try to tell my physicians, it's a lot easier than going through medical school. So basically, you just have to learn some of those financial benchmarking things, good operations flow, and Lean Six Sigma type of techniques of process improvement. You have to know some basic things about human resources and personnel management, and some basic marketing and business development. And so those are not that hard, really, and they will make you successful by taking the time to learn all of this. So I would like to open it up for questions now, and thank you very much for attending.
Wow, Debra, thank you so much. That was so much good information out there. I don't even know where to begin, but it was just a lot of really helpful insight on, you know, how to start your business and how to maintain your practice and marketing and the financials. And I can just speak for myself. I mean, when we work with clients, you know, we always tell them you got to know your numbers. You have to understand your financial situation. And what we typically do is we send out monthly financial reports to our clients so they can see exactly what their profit and loss is, how it's broken out by different categories, what their balance sheets are. So that way they can see on a monthly basis whether or not they're on track or not.
That's great. That's excellent. You know, that's what I always say. Physicians are going to need people with these expertise for the rest of their practice life. Your practice consultant, your good CPA, a lawyer, your pension planner, your wealth, administrator, all of those people are going to help make you successful because we all have our areas of expertise.
Yeah, absolutely. And, as far as questions, one of the things that has come up is, with the you mentioned rising overhead, but not revenue. Can you kind of expand on that a little bit? Because I hear this a lot from clients as well, is that, their overhead is rising because of, labor costs or just, costs in general, but declining reimbursement rates are really crimping their overhead. Can you talk a little bit more about that?
Yes. And, honestly, it's harder and harder to be a solo doctor because of that reason. So, what we usually try to say is that even if you go in with one other expense share partner or merge into, 2 or 3, you usually can save some money on those practice expenses because, you can split your fixed costs among more people. And you can generally make a little bit of a dent on your FTE per MD for the type of position. So that's the way to really actually look at reducing your overhead. And then you just really have to make some hard choices sometimes. Maybe you're not going to be able to go on as many continuing education trips, for example, or, again, when you work with some other doctor, you can share dues and journals and things like that by having a library instead of everybody, ordering the same thing. So you just have to look for ways to save costs. But rent and staff are the biggest, so that's why it really the only way to do that sometimes is to get more physicians in. In other words, you should be utilizing your exam room space as much as you possibly can by putting providers into, using those exam rooms. Exam rooms are like, I call them like crops. It's like if they're empty, their fields lying fallow and they're not making you any money. So the way to reduce everybody's costs is by more revenue by utilizing those exam rooms as much as you possibly can, Monday through Friday, maybe even some Saturdays, some early morning, like I said, or some one evening. That's the way that you reduce your overhead.
Yeah, absolutely. Especially speaking of, having exam rooms that are not being utilized, especially in a high rent area like Los Angeles or the Bay Area, where it's you want to use every square footage as possible. So we do have one question is, do you work with independent consultants who do not necessarily want to establish a separate physical practice? I'm not sure if you understand that question, but if you want, I can read it again.
No, not really.
Do you work with independent consultants who do not necessarily want to establish a separate physical practice? Does that make sense?
You mean physician independence or like consultants like me?
I'm not sure, but what we'll do is we'll post the question on our YouTube page once we, there's a clarification. Do you work with independent consultants who do not necessarily want to establish a separate physician's practice?
Well, I don't know if I still understand that as a, yeah, oh, but are you saying just improving existing ones? Yes, of course, everybody does that, but I don't know if I understand what they're trying to say. I really don't understand the question. I'm sorry.
Okay, yeah, no problem. Well, like I said, we'll post this question on our YouTube page, and hopefully the person will add some clarification questions to it. But I want to move on and maybe ask you a few other kind of clarification questions. Is you brought up the just a rapid increase of technology in medicine and just pretty much all facets of society nowadays, and the fact that it's driving down cost of medicine. What about compensation? Is it driving down cost of compensation? Because if it's driving down the cost of it, it's got to have some offsetting effect somehow.
Well, if you look at the data, most of the physician compensation has been increasing, though, believe it or not. And some of that is due to the hospitals subsidizing their physicians. They lose money on hospital-employed physicians. The average loss is $150,000 to $250,000 for the first year, and then it continues and persists thereafter. So they are actually subsidizing the physicians and losing money. However, they want to, the reason for that is that physicians bring revenue into the hospital, so they feel like if they've got this captured market that they're going to, get it on the end of the hospital side. But, as I said, we don't know how long that's going to last before they're going to start cutting back on the physicians. And certainly that is, I might want to say this, is that private equity, that's what they need to be very careful about, because it sounds great that they're going to buy this practice and, get you all your money up front. But then, if you were at the 90th percentile and you're making 200 grand more than your peers, yeah, you might get $2 million, but then they're going to dump you down to that compensation of the median. And in effect, if you get 2 million, you're going to, you're the tax guy. How much money are they going to lose on taxes? And then if you look at maybe half of it or something like that. And then, so then it's really maybe $1 million or $1.2 million or $3 million. And really over 20 years, you can make more in your own practice. So that's what I try to caution physicians, look long-term, not just short-term. Do the numbers and look at this, what it really means long-term.
Oh, that's such an excellent point, because a lot of people do, and it's not just physicians, they have that short-sighted view and they don't realize that, yeah, if you're getting some kind of money injection of $1 million or $2 million, whoever is putting that money in is going to want some sort of rate of return. And if they're not, and if you're operating an inefficient practice, or if you're not, if you're outside that, the norms or the medians, then they're going to push that price down. So it's super important.
Mm-hmm. Yes.
Okay, so we've gone, I think, way over on our time as far as what we've allotted, but this was really good information, Debra. Thank you so much for joining us. I really appreciate it. We've got your slide up there as far as how people can contact you. We'll also put this on our social media platforms for people to be able to connect and also ask additional follow-up questions. And thank you again for participating. Really appreciate it.
Well, thank you very much. And I really appreciate it.
All right. Have a good day.
Okay. Bye-bye.